we're trying to, find methods or methodologies that are better able to characterize kids with various types of developmental mental disorders. And the primary focus of this particular paper was ADHD. In the community, it's largely recognized that even though we have our current diagnostic tools, that the population of people that are diagnosed with the disorder, there's probably many different reasons or many different mechanisms that may lead to that particular behavioral presentation or outcomes, or phenotype as we call it. And so, of course, just noting that there's likely these different, that everybody's different is one thing, but actually demonstrating it is another thing. And so what we've done is taken many different behavioral problems that have been associated with ADHD, and shown that using various types of computational tools that we can actually identify subgroups of people with a disorder, and that they have different strengths and weaknesses. But probably just as important is that really to understand, any particular person, any particular child that may present with the disorder, that it's equally important to understand how the strengths and weaknesses of subgroups in the normal population is that even the typically developing population, that not everybody is the same. And I think that it's recognized that this is probably the case, but it's not often practiced or demonstrated either in the clinic or in research. Part of the difficulty with psychiatric disorders like ADHD is that we don't have very good markers for the disease or the disease type. We have to, at least at this juncture, rely on observation from parents and teachers and clinicians to characterize any given child. And that can lead to inconsistencies with regard to how one clinician may view the behavior versus another, or inconsistencies between parents and children. One of my favorite quotes from one of our community gatherings from a parent was asking myself and Joel Nigg, my close collaborator, who's a world-renowned ADHD scientist. She asked, "Well, how is it possible that my child can have ADHD at school but not have it at home? How can you, if I have cancer, I can't have it at work and then be fine when I come home?" And the reason is because we have better ways of characterizing cancer patients than we do with kids with ADHD. And now, whether the methods and the things that we've tried in this paper are going to replace kind of what is currently being practiced with disorders like ADHD as far as diagnostic, it's probably not going to be the case. But we can use it and probably use it in combination to help better characterize individual children with the disorder. It's certainly, the work is highlighting how amazingly complex the disorder is. I mean, it is extremely complex. And while we're looking at very specific behavioral categories in this particular setting, like I said, we're looking at things like attention behavior and memory behavior and variability and response type behavior. It's possible, if not likely, that there may be multiple brain organizational that maybe relate differently to each one of those even. And so, which is work that's ongoing, using different types of MRI technologies to try to, subcategorize, patients even further, is kind of currently in the work. So it's certainly one of the humbling aspects of the work is that the disorder is extremely complex with regard to how heterogeneous it probably is. And so that's the other, a big uptake, is that really to understand the disease process with regards to ADHD, it's likely going to be that we have to find ways to better characterize individual children with a disorder, but we also have to find ways to better characterize children that are developing normally.